Part D plans can now cap insulin costs at $35 for a month's supply. Insulin-dependent diabetic seniors will be able to sign up for a new Part D prescription drug plan or Medicare Advantage Part C plan that include prescription coverage from a program called the Senior Savings Model. These plans cap insulin copayments at $35 for a month's supply. This will begin this annual enrollment period from October 15th and last through December 7th for a January 1st effective date. Hi, I'm Chris Duncan, independent insurance broker specializing in Medicare. If you're new to the channel or haven't done so already, please subscribe to the channel or hit the bell for notifications. Don't forget to like our video and make a comment as well. To check Medicare supplement rates, go to our special site for this, MedicareRateQuote.com. You can also call us at 800-910-3382 with any questions, or you can visit our main website at TrustedBenefitsDirect.com. According to a press release from the American Diabetes Association, CEO Tracy Brown said at a White House event to announce the Part D senior savings model that the American Diabetes Association is committed to continuing the fight to make insulin and other drugs more affordable so that people living with diabetes can thrive. The press release also declares that people with diabetes in the United States account for 33% of every dollar spent on drugs. Also, diabetics spend about 2.5 times more on healthcare expenses than other Americans. This new model is the first federal measure designed to drive down insulin costs. As always, look below this video for links that I reference. According to diabetes.org, 26.8% of Americans aged 65 and older have diabetes. That's 14.3 million seniors diagnosed and undiagnosed. The White House claims that more than 3 million people on Medicare use insulin to help with their diabetes control. For diabetics requiring insulin, it is a life-saving component to manage their chronic condition. By lowering the cost or access to insulin, this can be an overall cost-saving measure for Medicare. When more insulin-dependent diabetics are able to access insulin, this staves off more serious complications that come from diabetes, including kidney failure, heart disease, stroke, vision loss, and much more. According to an article on CNN.com, insulin costs between $2.28 and $3.42 for a drug manufacturing company to produce. An article from WebMD states, the new price caps are not a U.S. first. A number of private insurers, pharmaceutical companies, and 9 states have already introduced various policies or legislation to limit the cost of insulin. States with laws that already cap insulin costs to between $25 and $100 a month include Colorado, Illinois, New Mexico, Maine, West Virginia, Utah, Washington, Virginia, and New York. The Centers for Medicare and Medicaid Services head, Seema Verma, acknowledges plans that will offer the insulin cap, they will have a higher premium. Verma states the extra premium will be around $17 per month. However, in exchange for this monthly price increase, the maximum fixed copay for a month's supply of insulin will be capped at $35. Verma also states seniors will have around a 66% savings on their insulin costs. According to Verma, this insulin cap costing can also be a precursor, if successful, in an attempt to lower the cost of other expensive drugs. Verma states, we're starting with insulin, but depending on the progress of this, we will consider offering this flexibility to manufacturers and plans with other drugs depending on the results. Verma goes on, we think that this creates a foundation and platform to fixing some of the problems that we have in the Part D plan. It's time for that program to be updated. Holly Campbell, a spokesperson for Pharma, a pharmaceutical trade industry association, notes, insulin isn't the only diabetes medication with a steep price tag. Newer medications for type 2 diabetes such as GLP-1 and SGLT2 may also be priced out of reach for those on certain insurance plans. Now, I don't know what GLP-1 is and SGLT2 are, but if you're curious, go ahead and Google them up. If you want to join the conversation, leave a comment below and let us know what you found. 88 different insurers have agreed to participate in the senior savings model for Medicare drug benefits. Around 1,750 different Part D prescription plans and Medicare Advantage plans with Part D drug coverage will participate in the senior savings model. The Part D senior savings model was announced on March 11, 2020. The participation in the Part D senior savings model is entirely voluntary by Part D insurers. By participating in this model, Part D plans will be able to provide supplemental benefits for a broad range of insulins, including pen and vial dosage for rapid-acting, short-acting, intermediate-acting, and long-acting insulins. If a Part D insurer wishes to participate in the senior savings model, this will allow participating pharmaceutical manufacturers to pay their discount for insulin during the coverage gap. The pharmaceutical manufacturer's discount is 70%. Under the current Part D plan model, Part D plans can offer lower cost sharing than is required by Medicare in the coverage gap if they choose. When a Part D plan does this, however, the Part D plan sponsor, also known as the private insurance company, takes on costs that the pharmaceutical manufacturer normally would pay. Subsequently, this results in higher premium costs to Part D plans for the Medicare beneficiary. The new insulin model will allow for manufacturers to continue paying their full coverage gap discount for the insulin, even when the Part D plan already offers lower cost sharing. Next, this will require a Part D plan that decides to participate in the new insulin model to lower cost sharing or copays to a maximum of $35 for a month's supply for the broad set of insulins. What is important to remember with this new plan is if a Medicare beneficiary has a prescription plan that participates in the insulin cost-saving measures, that the $35 cap will apply to all phases of Part D coverage. This means the $35 cap will also apply when a Part D beneficiary is in the coverage gap, also known as the donut hole, and the catastrophic phase as well. This fluidity of cost was one of the Centers for Medicare and Medicaid Services goals. With current coverage rules for Part D, costs can fluctuate greatly month to month during the 4 coverage phases, which are the deductible phase, initial coverage phase, coverage gap phase, and catastrophic phase. To learn more about Part D prescription coverage and how these phases work, you can go to our article link that is listed below this video and also watch our video as well. Our video link is provided in the description below. The New England Journal of Medicine reports in 2019 that the typical Part D plan that is covering a Medicare beneficiary using long-acting insulin and also has no other drug expenditures will spend around $1,140 for 12 insulin fills during the year of 2019. This means in 2021, if this same example Medicare beneficiary is used, these 12 insulin fills will result in a total cost of $420. That's 12 fills at $35 each. This example has a savings of $720 for the entire year. These plans will begin in January of 2021. These plans are available in all 50 states, the District of Columbia, and Puerto Rico. If you are an insulin-dependent diabetic, this year's annual enrollment period will be especially important for you. This will be your chance to shop and compare costs and benefits in your area of all the companies offering standalone Part D prescription coverage or Medicare Advantage Part C plans that also include Part D drug coverage, and this will enable you to see which plans will fit your specific needs. Calendar year 2021 plan benefits must be submitted to CMS by June 1st, 2020 for those Part D plan sponsors that have applied. The final information on the senior savings model is expected in September of 2020 and will include premiums and costs. Thanks for watching again if you viewed some of our other videos, and if you're new, hey, thanks for watching this first one. If you have any questions about this or any other questions about Medicare in general, we are here to help. We help with Medicare supplement plans, Medicare Advantage Part C, Part D prescription drug plans, protecting retirees' retirement, and much more. Again, I'm Chris Duncan, and I run an independent Medicare agency. We don't work for the insurance companies. We work for you, and all of our services are free. Because we are independent, we get to represent many different companies to help you make the exact right decision for your needs. It is easy to contact us. You can do so toll-free at 800-910-3382. Get a free Medicare supplement quote at MedicareRateQuote.com, and you can fill out our contact form on our website, TrustedBenefitsDirect.com. If you found this information helpful, please subscribe to our channel. Please make a comment. I'm always curious to learn what you think about this subject, or share it to your social media like Facebook and Twitter. We are always putting out information and important news and updates to help with things like Medicare Basics, Medicare Made Clear, Medicare Explained, Medicare 101, and much more. Thanks again, and we'll be talking with you soon.